Greetings. I am Irad, Chief Medical Officer of the British Virgin Islands. Today, I want to have a conversation with you about Zika virus. As you may have heard by now, Zika virus is present in the region of the Americas. Over 20 countries in the Caribbean and the Americas have Zika virus present. To date, no cases of Zika virus have been reported from the territory of the Virgin Islands. However, we know that we have the vector that transmits the Zika virus. We know that we've had dengue, we know that we've had chikungunya, and we can very well expect that we may have Zika virus. We should not wait until the first case of Zika virus is diagnosed in the territory to become concerned. We are a people that travel often, and we are a territory that receive a lot of visitors daily. So it is very likely that Zika virus will arrive on our shores. Zika virus is transmitted by the Aedes aegypti mosquito, which is a vector that is present in the territory. Reduction in the indices of Aedes aegypti will reduce the risk of transmission of Zika virus. We can reduce the indices or the presence of Aedes aegypti in the territory by reducing its breeding sites. Aedes aegypti is a mosquito that lives in and around where we live, work, and play. And simple measures can be used to reduce the breeding of Aedes aegypti. Persons with Zika would have a fever, a rash, joint pains, and red eyes. About 1 in 5 persons who have Zika will not have any symptoms. That is, they will not show any signs of illness. Zika is transmitted when the mosquito bites an infected person and then has a blood meal by biting another person. Zika in Brazil and in the Polynesian Islands have been linked to microcephaly and to neurological disorders such as Guillain-Barré syndrome. This means that although the majority of persons who are infected with Zika will have mild illness, some persons may have significant complications from the virus. We have, over the past few weeks, been preparing within the Ministry of Health and other government agencies to reduce the risk from the presence of Zika virus in the territory. I know when we begin to discuss mosquitoes, people often say we need to fog more. But fogging by itself is not enough. Fogging kills adult mosquitoes, but it also kills other insects that we don't intend to kill. Zika can be controlled by controlling breeding sites around where we work, live, and play. Persons in communities can protect themselves from mosquito bites by using insect repellent, by wearing long sleeve clothing. And persons who are already infected with Zika virus can help to protect others in their households by using mosquito nets that are impregnated with insecticide. It is important that we undertake together as a territory to combat and reduce the risk of the spread of Zika virus in the territory. We don't want to wait until the first case occurs. Therefore, I implore you, wherever you work, live and play, conduct weekly surveillance activities for breeding sites. Search and destroy. Mosquitoes are not our friends. The Aedes aegypti mosquito carries dengue, chikungunya, and now we have Zika. Persons who are pregnant or who are planning to become pregnant should be extra vigilant about encouraging their households to reduce the source of mosquito breeding in and around their homes, in and around their workplaces, in and around the places where they go to play. It is important that as a community we come together to reduce and minimize the risk of the possible impact of Zika on our people. Remember, it is better for us to prevent the breeding of mosquitoes and so to reduce the presence of Zika virus in the territory. There is no treatment specific for Zika. There is no vaccine. We therefore need to act now before we begin to have cases to ensure that if and when we do have a case, we are able to minimize the spread of Zika virus. Thank you.